Hi guys, this is Miss Valoria, and along with Miss Aspilia, Miss Bularan, Miss Chong, Miss Faaldo, Miss Masukol, and Miss Sano, guided with our clinical teacher, Miss Mantos, we will be discussing to you the topic Remotivation Therapy. And now, without further ado, I will be reading to you our objectives. After 5 hours of varied learning activities, the students will be able to first define the terms related to remotivation therapy. Second, cite the goal of the remotivation therapy. Third, is discuss the purpose of the remotivation therapy. Fourth, list down the indications and contraindications of remotivation therapy. Fifth, explain the guidelines in performing remotivation therapy. Sixth, enumerate nursing responsibilities before, during, after remotivation therapy. Seventh, discuss the qualities of a good therapist. And lastly, number 8, enumerate the steps in remotivation therapy. And now, Miss Aspilia will be discussing the first objective.
So good day everyone, my name is Dimples Aspilia and I will be discussing the very first CLO, which is to define terms related to remotivation therapy. So our first term, we have affect. So affect is a visible reaction a person displays towards events. It is the outward expression of the client's emotional state. So this is more of the expression of your emotion inside. So an example would be when a friend passes away, the reaction would be sadness and tears. So the emotion would be sadness, so your outward expression or your affect would be to cry or to have tears. The second one, we have remotivation therapy. So remotivation therapy is a small group therapeutic modality in nature. So it is designed to help clients by promoting self-esteem, awareness, and socialization. So remotivation is a technique of a simple group therapy, objective in nature, used with a group of patients in an effort to reach the unwounded areas of each patient's personality and to get them thinking about reality in relation to themselves. So remotivation differs from other therapies because it focuses more on the patient's abilities rather than the disabilities. For our third term, we have lagda. So lagda is a Visayan word which means norms, guidelines, rules, or regulation. An example of a lagda or rule is in sensory stimulation therapy, so the clients should only and can only speak when it's their turn. For our fourth term, we have therapist. So therapist is a person. So a therapist is someone whose job is to treat a particular type of mental or physical illness or disability. So it is usually within a particular type of therapy. So for our fifth term, we have environment. So environment includes all forces that act upon the individual, and it is the surroundings or condition in which a person, animal, or plant lives or operates. So basically, it's anything that has an influence in an individual. Number 6, we have apathy. So apathy is the feeling of indifference toward people, activities, and events. So an example of apathy would be a student who does not care one way or the other if he or she passes the class is an example of a student who has apathy towards the class. So for our seventh term, we have disorientation. So disorientation is an altered mental state. So a person who's disoriented may not know their location and identity or the time and date. So an example of this would be a person using a powerful drug might feel so disoriented that he or she does not know who she is, where he is, or where or he or she was in time. So that would be an example of a disoriented person. So basically, a disoriented person is someone who's not aware of his surroundings anymore. So for our eighth one, we have depression. So depression is a major depressive disorder which is common in a serious medical illness that negatively affects how you feel, the way you think, and how you act. So depression causes feelings of sadness or a loss of interest in activities you once enjoyed. So it can lead to a variety of emotional and physical problems and can decrease your ability to function at work and at home. For ninth term, we have emotions. So emotions are conscious mental reactions subjectively experienced as a strong feeling usually directed toward a specific object and typically accompanied by physiological and behavioral changes in the body. So an example of an emotion would be happiness, anger, sadness, fear, disgust, and etc. So conflict. So this is the arousal of two or more strong motives that cannot be solved together. So an example would be people who are contemplating suicide. So they may have conflicting feelings inside them. So they have desires to die, however, they frequently reach out to others for help. So this would be a conflict, so an internal conflict in their part. For the 11th term, we have delusion. So delusion is a belief that is clearly false and that indicates an abnormality in the affected person's content of thought. So it is a fixed false belief not based on reality. So there are different types of delusion. So the first one, we have persecutory or paranoid delusions. So this involves the client's belief that others or the other people are planning to harm the client or are spying, following, ridiculing, and belittling the client in some way. So an example of this would be when the client thinks that the food has been poisoned or that the rooms are bugged with listening devices. For a second type, we have grandiose delusions. So it is characterized by the client's claim to association with famous people or celebrities. So the client's belief, it is also when the clients believe that he or she is famous. So an example would be claiming to be the daughter of the President of the United States. For a third one, we have religious delusions. So it is often centered around the second coming of Christ or another significant religious figure or prophet. So an example would be when the client claims to be the Messiah or the prophet sent from God. Our next type would be somatic delusions. So these are generally vague and unrealistic beliefs about the client's health or bodily functions. So factual information or diagnostic testing does not change this belief. So an example would be when a male client who says that he or she is pregnant, or the client may report decaying intestines or worms in the brain. For our last one, we have referential delusions. So these are ideas or reference that involve the client's belief that television broadcast, music, newspaper, articles have a special meaning for him or her. So an example would be when the client reports that the president was speaking directly to him on a news broadcast. For our next term, we have hallucinations. So hallucinations are false sensory perceptions or perceptual experiences that do not really exist. So hallucinations can involve the five senses and bodily sensations. So there are also different types of hallucinations. So the first one, we have auditory hallucinations. So it is the most common type that involve hearing sounds. And an example would be hearing voices talking to or about the client, voices demanding that the client take action, often to harm self or others, and this is considered dangerous. For our next one, we have visual hallucinations. So it involves seeing images that do not exist at all. So examples would be lights or a dead person or distortions such as seeing frightening monster instead of the nurse. For a third one, we have olfactory hallucinations, which involve smell or odors. So an example would be smelling a specific scent such as urine or feces, or a more general scent such as rotten or rancid odor. For our next one, we have tactile hallucinations. So these refer to sensations. So an example would be electricity running through the body or bugs crawling on the skin. For our next type, we have gustatory hallucinations. So it involves a taste lingering in the mouth or the sense that food tastes like something else. So an example would be the taste of a metallic or bitter or maybe represented as a specific taste. For our next one, we have synesthetic hallucinations, which involves the client's report that he or she feels bodily functions that are usually undetectable. So examples would be sensation of urine forming or impulses being transmitted through the brain. And for our last type, we have kinesthetic hallucinations. So these hallucinations occur when the client is motionless but reports the feelings of sensation of bodily movement. An example would be floating above the ground. For our next term, we have illusion. So it is something that deceives by producing a false or misleading impression of the reality. Number 13, we have illusion. So it is something that deceives by producing a false or misleading impression of the reality. So an example would be an electrical cord on the floor, which may appear to the client with delirium to be a snake. So number 14, therapy. This is the treatment of disease or disorders as by some remedial, rehabilitating, or curative process. And for the last one, we have disengagement. So this is the detachment of self-esteem from external feedback or the outcomes in a particular domain, such as the feelings of self-worth are not dependent on the successes or failures of that domain. So an example would be in older adults, they tend to withdraw from society and personal relationships as they age.
Hi, I'm Jasmine Ashley Opingo Valaran, and I am tasked to discuss the CLO number 2 and number 3, which is the goal and purpose of remotivation therapy. So, before we start with CLO number 2, what is the difference between a goal and a purpose? So, in my knowledge, and as I have read, the goal is what you want to achieve, while the purpose is why you want to achieve it. You can simply put it this way, that the goal is more on the bigger picture, while the purpose is more on the smaller picture, but like detailed and specific ones. Yes, so to start, we have the goals of remotivation therapy. So I've gathered 6 actually. So the first one is provides more on simple objective aspects to everyday life, because I have also read in the handbook of remotivation therapy by Dyer and Stotts that they said there that remotivation therapy is more of giving an effort to reach the unwounded areas of each patient's personality and get them thinking about reality in relation to themselves. So, to continue, we have 4th, an improved sense of belongingness. 5th is increased feelings of self-worth. And 6 is to develop acceptance and disengagement. Because I've also read there that remotivation therapy differs from other therapies according to that handbook of remotivation therapy. It's said there that it focuses more on the patient's ability rather than their disabilities. So to continue, we have the CLO number 3, which is the purpose of remotivation therapy. So the first one is it helps client by promoting self-esteem, awareness, and socialization. This is because in remotivation therapy, it is held within a small group and with therapeutic modality designed to help clients with each other. And number 2 is to promote discussions of topics that may bring participants closer in touch with the world outside the institution. Third is re-socialize regressed and apathetic patient. Now this will be discussed later, but these patients are indicated for this remotivation therapy. Fourth one is reawaken their interest in the environment. And the 5th one, increase the participant's sense of reality. So it is because in remotivation therapy, it aims to anchor clients in the reality of their world and help them navigate that world through making responsible decisions that bring them closer to their goals. Number 6, it relates to the creation of interest in life. For example, in a person's daily activities, talents, hobbies, and social relationships with family and friends. And 7, it contributes to the improvement or maintenance of first, their level of interest. Second, ability to respond to direct questions. Third, volunteering information. Fourth, relevancy of verbal expression to content. Fifth, level of awareness. Sixth, level of cooperation. Seventh, consideration for others in the group. Eighth, level of confidence. And ninth, cognitive and physical skills. And the last one will be the increased hope and courage, because as I have also read, in remotivation therapy, we do not just help them to survive physically, but also help them for themselves to thrive, to survive. And that's all.
Good day everyone, I am Miss Kim Joanna Chong, and for today I will be discussing CLO number 4, which is to list down the indications and contraindications of remotivation therapy. So now let us start with the indications of remotivation therapy. So remotivation therapy is indicated for clients who are chronically mentally ill. So this is done to stimulate their communication, vocational, and social skills and interests in their environment. Second indication is socially isolated clients. This is to help in the value of personal strengths and to recognize specific features and unique traits of oneself. Third indication are for depressed clients or clients at risk for depression. This is to help clients by promoting self-esteem, awareness, and socialization. So as what was discussed earlier in the purposes of remotivation therapy, the clients during the therapy will be reoriented in reality, and at the same time they will be stimulated in order for them to be interested in their environment. So to continue on with the indications of remotivation therapy, we have here our fourth indication, which is remotivation therapy is indicated for clients who are ready to be discharged. This is to create interest in life, especially in the client's daily activities, talents, hobbies, and social relationships with family and friends when out of the hospital facility. So since the client is ready for discharge, we have to reorient them with their environment, since the environment within the hospital facilities and outside the hospital facilities are different. The last indication are for the disoriented clients. This is done to therapeutically help clients be familiar with their environment and to create interest. Also, this is very vital for reality orientation for the clients. So, since these clients are disoriented, we have to reorient them and make them be aware of the environment that they are in, especially the things that are going on around them. So for this slide, we have here the contraindications of remotivation therapy. So the first two contraindications are clients who are experiencing hallucinations and clients with delusions. This is because during remotivation therapy, the client needs to be focused in order for the therapy to be effective. Third contraindication are violent clients. This is to ensure that both the therapist and the client will not be harmed throughout the therapy. And also this will ensure the safety, and also this will protect both the therapist and the client. The last contraindication are uncooperative or when clients refuses. Since remotivation therapy requires communication and the client's motivation to adhere with the therapy. So when the clients are uncooperative, the flow of the therapy will not be smooth and the therapy alone will not be effective. Hence, when this happens, the goal of the therapy or the goal of remotivation therapy will not be met.
Number 1, the therapy must consist of a therapist and 10 to 12 members with different behavioral patterns. So the rationale for this is that a therapist is really needed so the therapy will be effective, and so there would be a moderator and a coordinator in the said therapy. It consists of 10 to 12 members since remotivation therapy is also part of group therapy, so there's really an intended number of members. Next, the arrangement of patients must be in semicircle and the therapist must be at the center. So this is to facilitate active participation between the therapist and the client, and this is also to prevent clients from being suffocated to the area or the seats that they are sitting in. Next, the therapy should be done 45 minutes to an hour weekly. So the clients are asked, each of the clients are asked, 10 to 12 members or number of clients are asked, and we are not allowed to cut off the discussion. So there's really set time, which is 45 minutes to at least an hour. And the client should be asked from left to right and vice versa. So this is also to provide a discipline within the members who participated in the therapy, and for them to be aware that there will be taking turns in every procedure that will be done in the said therapy. The therapist should always build trust first before proceeding. So we need to build rapport, we need to communicate with our clients, so our clients will somehow trust us, and so our clients will be able to open up his or her feelings, and so we can also understand them. And then next, ask the clients to verbalize their thoughts and feelings. So the purpose of remotivation therapy is to remotivate our clients. We need to regain back all the losses of our clients, and with that we need to ask them about how they're feeling, what are their thoughts, or what are their thoughts in their state right now. So we really need to facilitate, we really need to communicate. So we will be discussing. Okay, so for the 7th one, we have to answer and validate all the questions that will be asked to us by our clients. So since, as what I've said earlier in remotivation therapy, we need to remotivate our client. We need to clear things out, especially those things that they're very confused of. And we need to let them understand also, make them understand. And then next, do not cut off the discussion. So we're not allowed to cut off the discussion. Instead, we encourage our client to open up, to speak, to voice out what they are feeling right now, and what they are thinking as well. Next, do not dig into a deeper meaning. So digging in can lead to confusion, and we can also in this way we can mislead our client. So we want to avoid that, so we can focus on what's really the problem of our client. So we need to avoid digging in, especially the things that are already outside the box or outside the topic that we are talking. Next, we need to avoid our own judgment and criticism. So we want to give an effective intervention or treatment to our client. We need to give good advices that can surely help them with what they are going through. And so with that, we need to set aside our criticisms, our biases. So we can give good advice, we can give proper or appropriate intervention that they need. Next, we need to protect the client at all times. So we need to provide safety to our clients, and of course, privacy and confidentiality is strictly practiced to any kinds of therapies that we'll be doing to our clients, because they are our responsibility and we are liable to anything that will happen to them. So I hope that's it for my report. I hope you learned something. Thank you and have a great day.
Good day everyone, I'm Erica Masuko from BSN 3C, and I will be discussing CLO number 6, which is the nursing responsibilities before, during, and after remotivation therapy. Let us begin with before the remotivation therapy. So first, we have to find and set a suitable environment. So a therapeutic environment refers to a physical space that is set up to allow individuals to work through and overcome their medical issues. So we have to make sure that the environment is free from distractions or stressors to allow the patient to concentrate and express their feelings. Next is to introduce oneself and create a friendly relationship by establishing an open communication. So it is important for the nurse to build rapport with the client to be able to have a successful therapy. So nurses should not come off as intimidating but rather friendly and approachable to the patients to allow them to open up to them more. So in communicating, use both physical and personal interactions such as touch and maintaining eye contact. So one of the most significant aspects of touch is the ability to convey and enhance physical intimacy. So as well as sustained eye contact, which is an invitation to turn your talk into a conversation. So it creates a bond between the nurse and the client. So when you look into someone's eye, they're most likely to look at you and they most likely listen and buy into your message. So let us proceed with during. So ask questions carefully and politely. Questions must be tackled from a general to specific point. So this pattern is characterized by movement in your thinking from a generalization to specific details. So your opening paragraph would begin with a general statement and then add details to explain it further. The pattern ends with a broad statement that summarizes your thinking that resulted from the details. Next is acknowledge and give your full attention to what the patient is trying to convey. So as a nurse, you should always give your full attention to your patients and grasp all the information that they are trying to convey. This will help you understand the situation at hand. Next is to take note of the verbal and the non-verbal communication. So the non-verbal communication increases the understanding of the messages. So it establishes a better perspective on the message being sent. Next is to use open body language and avoid crossing the legs and the arms. So body language is an important aspect in communication. So it helps break the unfamiliarity and helps to form a better connection with your client. So lastly, we have after. So summarize the session and focus on the important ideas that were shared among the clients. Give appreciation to the client with their efforts, attendance, and the contribution. So giving appreciation will show positive regards so that they can continue to be more interactive and motivated for the next sessions. Inform the client on the information relating to the following sessions and invite the group members. Record observations and analyze the interactions made correctly and precise. And lastly, document the date performed and submit recorded interaction with the psychologist or the psychiatrist. So that is all from my part. I hope you learned something.
Good day everyone, this is Miss Norika Steffi and I will be discussing the qualities of a good therapist. So first quality we have is a therapist must possess a sophisticated set of interpersonal skills. Having good interpersonal skills also show warmth and acceptance towards their clients. Effective therapists are able to express themselves well and very keen at sensing what their clients are thinking and feeling. In this way, clients have this reassurance of acceptance in whatever they are about to convey to their therapist. The next quality is trustworthy. A good therapist is someone who helps their clients feel comfortable in sharing their thoughts and feelings. Clients believe that their therapist will be helpful if they both communicate verbally and non-verbally. That the therapist is someone the client can trust, and with that, clients feel comfortable in sharing their thoughts and feelings to the therapist. The next quality is empathic. A good therapist is able to recognize, understand, and share the thoughts and feelings of their clients. Being empathic is putting yourself in someone's shoes or situation. It involves experiencing a client's point of view rather than just one's own. With this, therapists are able to understand more what the client feels or thinks. Another quality is a therapist must be willing to establish an alliance with their clients. When clients feel they are in partnership with their therapist, this will lead to a good therapeutic outcome. To establish alliance with the client, the therapist must have goals that both the client and therapist agree on. So next is the ability to provide an explanation of a client's condition. Effective therapists provide explanations that clients can understand, and clients want to know how they are doing from an expert's point of view. From this point on, the clients will be able to accept and participate in what their treatment plan will be. Another quality is being committed in developing a consistent and acceptable treatment plan. The therapist will develop a treatment plan suitable for the client and share it with them. After the therapists conduct an assessment to the client, the therapist will develop an individualized treatment plan suitable for the client to help for better recovery process. Next, a good therapist must convey confidence. When a therapist communicates confidence towards their clients, this will allow the client to feel secure, which means that they are assured with the knowledge that the therapists have and knows what they are doing and why. Another is being attentive and shows interest to the progress of therapy. Good therapists are interested in finding out how their clients are responding to treatment. Being attentive and having interest show that the therapist wants their clients to improve. Another good quality is flexible. A good therapist is willing to make accommodations for the client's particular characteristics, which means that a therapist does not only follow a rigid schedule of treatment, as in a one-size-fits-all approach, but rather is flexible to the client's needs. Next, a good therapist is sensitive towards client's cultural background. A good therapist shows respect for the client's background and is aware of attitudes within the client's culture or community. For example, family relationships, religious practices, and appropriate behaviors. Another is possession of self-insight. An effective therapist is self-aware and is able to separate own issues from those of the clients. A good therapist is good to talk to but does not talk back at their clients about themselves, which means that the therapist's focus is always their clients. So next is the reliance on the best research evidence. Therapists acting in accordance with APA's evidence-based practice guidelines stay abreast of the latest developments in clinical psychology, particularly in their areas of expertise. So it is ideal that the therapist alter their treatment approaches to be consistent with the latest knowledge according to research evidences. And lastly, we have the involvement in continued training and education. Licensed mental health professionals must participate in continuing education to maintain their credentials. This is important as they are required by law to seek and complete this training to be able to maintain their credentials and continue their job as therapists. So that is all for the qualities of a good therapist.
Hi, so this is Miss Viloria, and I will be discussing the last objective, which is the enumeration of steps in remotivation therapy. Step 1. Creating a climate of acceptance. So in this step, the client will be set up in a semicircle consisting of at least 10 to 12 people. So the therapist, or what we call as remotivator, will introduce himself or herself first and greets and of course welcomes the client. That creates a warm, non-threatening, friendly relationship that includes physical and personal interactions such as touch or eye contact. So the members will be acknowledged by their names and will be given attention and positive commentaries in regard to any aspect that makes the individual unique. So the conversation could also be in relation with politics or any social issues that is currently happening. Or it could also be weather, trivia, and of course, facts, as long as it is considered as a relevant information. Step 2. Bridge to the reality. So introduction of a topic that is relative among the group through the reading of objective therapy. So in this step, the therapist shall lead the session in the form of question and answer in regard to the topic. So the topic will be tackled from general to a specific point. There will be 3 to 4 questions with 4 possible answers that will be made ready in advance by the therapist. So in this manner, the answer will be able to lead to the next question. So the last question posed will lead into the poem, which is read by the client. Step 3. Sharing the world we live in. So in this step, there will be expansion on the topic by the therapist by asking 8 to 10 questions in regard to the topic. So each participant or client in the group will be asked the same questions. So these questions will be asked in the same manner as how news articles are written. What, when, where, why, and of course, the how. So the remotivator or the therapist shall stimulate the clients to think about the topic in relation to themselves and of course their reality. So here the questions shall be called for subjective aspects of the topic. For example, his or her past experiences and of course personal opinions and points of view. Step 4. Appreciation of the work of the world. So for this step, the questions are related to the work world. So the therapist or the remotivator will develop a topic through a thorough planned, open-ended, factual, and of course, objective questions. And these objective questions promotes discussions and interactions among the clients. So questions will be successively placed in order to avoid dispersion and keep the debate continuous and alive. The last step, or step 5, climate of acceptance. So provision of a brief summary of the session that focuses on the most important ideas exchanged among the clients will be done by the therapist. So in this step, it is the situation where there will be appreciation for the client's effort, attendance, and their contributions. So the therapist ends it with information on the following sessions, inviting the group members and transmitting a sense of continuity. Okay, so in this course of the session, the therapist shall not assume the role of lecturer, but rather he or she must speak in a non-threatening and non-judgmental manner, regardless of the client's response to the presented topic. So there will be an individual acknowledgement that will be taken in place. With the use of open-ended questions, the therapist will seek active listening, verbalizing appropriately and discussion, attentiveness to the activity, appropriately in accepting redirection, making an effort also to communicate with other group members, and showing or expressing positive feelings in the group. So that ends our discussion on remotivation therapy, and I hope that you have learned something from us. See you soon!